Hello, please have a seat, Mrs. K.
Thank you.
My name's Jane. It's nice to see you again. I can see you're here for your 6-week postpartum appointment. How is everything so far?
I'm doing well, as is my son John. I've learned so much in the last month.
I'm sure you have. Before we talk more, I want to let you know that what we discussed today is confidential. I'll write it down in your chart, but it won't be shared with anybody.
Okay.
It's great you came to have a checkup for you and John. I see from your chart that you had a normal delivery and there were no complications with his birth. How have you been feeling?
Good, just a little tired.
I need to ask you about some complications. Have you had any of the following, like pain in your belly, blurry vision, or severe headaches, fits, dizziness, convulsions, trouble breathing? Okay, great. What about very heavy vaginal bleeding or discharge?
No.
And feeling so tired you just feel like you can't get up, or feeling very sad or worried?
No.
Okay, that's good to hear. Are you still having any bleeding?
No, it stopped about 10 days ago.
Good. Sounds like everything is okay with you. What about your son, John?
Not really anything out of the ordinary. He took a while to feed regularly, but now he's nursing very well.
So you haven't noticed any fever with him, unusual color, weakness, poor cry?
No.
Difficult to calm down, maybe?
No.
Any pus from his cord or any discharge from his eyes?
No, none of that.
Sores or swelling anywhere?
No.
Does he ever feel really cold to the touch?
No.
Okay, that's great. Let's talk about how things are now. I see that John wasn't preterm and that there were no complications for you or John around delivery. Are you sleeping under an insecticide-treated net?
No, we don't have one.
It's very important to prevent malaria for you and the baby and, to prevent complications. If you get one today, will you use it?
Yes.
Okay, great. Well, we'll get you one before you leave. So are you exclusively breastfeeding John now, giving him nothing but breast milk?
Yes, I am. The nurse told me I should exclusively breastfeed for at least 6 months.
Before John was born, were you tested for HIV?
Yes, during my pregnancy I was tested for HIV and I'm HIV negative.
Okay, that's great. I just want to confirm this. Otherwise, there are some precautions we would need to follow to reduce the risk of John contracting HIV through breastfeeding. It's important to continue to breastfeed him exclusively for the first 6 months. Breast milk is the ideal food for John. It gives him all the nutrients he needs for healthy development and will protect him from illnesses like diarrhea and pneumonia. After John is 6 months old, you can add in complementary feeding. Is he nursing well?
Yes, he had some trouble in the beginning, but now he's feeding very well.
Okay, that's good. Have you and your partner resumed intercourse since John's birth?
No, not yet. My husband wants to, but I'm afraid it's going to be painful.
Well, I understand. It's okay to wait, especially to wait at least the 6 weeks. But if you want, you can resume sex any time now, from now on. However, you can get pregnant, so you don't want to take precautions. What do you know about healthy timing and spacing of pregnancy?
I've heard it's best to wait about 2 years before you have another baby.
How long would you like to wait before getting pregnant?
Probably at least 1.5 years.
So are you interested in something called lactational amenorrhea method, or the LAM method?
Yeah, I am. Can you tell me about that?
Okay. Have you and your partner resumed intercourse since John's birth?
No, not yet. My husband wants to, but I'm afraid it's going to be painful.
It's okay to wait, especially at least the 6-week period. But if you want, you can resume sex any time from now on. However, you can get pregnant if you don't take precautions. What do you know about healthy timing and spacing of pregnancy?
I know it's best to wait 2 years before having another baby.
That's right. But how long would you like to wait before getting pregnant again?
At least 1.5 years. They told me about breastfeeding method during the antenatal clinic. Will that work?
So you mean the lactational amenorrhea, or the LAM method, is that right?
Yeah, that one.
Okay, so what do you know about the LAM method?
I know that you have to breastfeed only, giving no other fluids or food to the baby, and that you need to breastfeed all the time, including during the night, and that you shouldn't be getting your menses.
That's correct. If you start bleeding, you may get pregnant, and you need to be breastfeeding during the day and night. You should come see us before your baby turns 6 months to get a different family planning method, because it really only works in the first 6 months of the baby's life.
Okay.
So we'll get you the insecticide-treated net for you and your family to sleep under. A few other things before I examine both you and John to make sure you're fine. It's important you wash your hands before handling the baby, and both you and the baby need to keep clean in order to prevent infection. Okay. Do you have access to running water and soap?
Yes, you do.
Okay. All right, good. Now I'd like to do a physical exam on both you and John just to make sure you're doing fine. But first I'm going to get John's weight, his height, and head circumference. Okay?